Well, greetings and welcome to our live question and answer portion. This is following the session we were all just in, which is MCH Stories for Change. We are joined by our presenters. So what I'll do is introduce myself and my fellow AMCHP staff, give her an opportunity to introduce herself, and then ask the presenters to briefly introduce themselves. And then for those who are participants, please go ahead and share in the chat where you're from, where you're joining us from. It doesn't look like we had any questions in the conference platform. So if you have any questions, please go ahead and chat them in, or you can unmute yourself and ask those. So my name is Athea Chaudhry, and I am the Senior Program Manager on the Health Systems Transformation Team at AMCHP. And I am joined by Courtney, and I'll give her a minute to introduce herself.
Hi, everyone. My name is Courtney Sally, and I'm a Program Manager on the Equity, Epidemiology, and Evaluation Team at AMCHP. Happy to be with you all today.
Great, and then I'll turn it over to my presenters, starting with Christina.
Thanks, Cynthia, and good afternoon. My name is Christina Wint. I'm the Senior Program Manager for Reproductive and Maternal Health and Wellness at AMCHP, and I'll pass the mic to Lisa, since you're next to me.
Hi, my name is Lisa Klein. I am the coordinator for maternal mortality review for the state of Delaware, and happy to entertain any of the questions after my colleague Rosemary gets an opportunity to introduce herself.
Good afternoon, everyone. I'm Rosemary Fournier, and it's my privilege to work with the National Center for Fatality Review and Prevention. My role there is technical assistance and resources and support for the fetal and infant mortality review teams, or FEMR teams, around the country.
Great. I believe that is our wraps up our presenters introducing themselves. And for those who are participating, please feel free to let us know where you're joining from. And I'm going to double check the conference platform to see. So no questions in the conference platform. However, we have a great number of people in our Q&A session. So please, chat in your questions, or you're welcome to unmute yourself and ask any questions about presenters. If you want to share any reactions, comments, this is also the place to do that.
Hi, everyone. I have a question. This is Rachel Ralia. I'm the maternal and child health epidemiologist in New Mexico. Thank you for a wonderful presentation. I thought it was really insightful, and I really appreciate hearing the stories and really humanizing the lived experience of the folks who live these, unfortunate circumstances. I am on all of our child fatality reviews, and safe sleep is a topic that's of dire importance and concern for us. And I've been contemplating these individual stories, right? But I wanted to know, have any of you had or seen any success with families sharing their stories publicly, or agreeing to share their stories publicly on a wider platform? Because I think this could be a really useful tool to, like I said, humanize the experience and raise awareness to certain conditions and systems. But I would love to hear your experience or your thoughts on that. Thank you.
Well, I'll start and just say that I think we're starting to see more of this. I think we're beginning, if you look at a lot of the platforms like Hear Her, the Hear Her campaign that the Centers for Disease Control has right now, and families are telling the stories about women who died in pregnancy, but with Hear Her, what's happening now is that women who've had near misses are coming forward and talking about their stories. And it can be very hard. I think a lot of times professionals feel that it's accusatory, when in reality, we have to step back and accept the fact that the outcome for this person was not what anybody wanted. And to hear the perspective of the people who experienced the outcome is something that we have to be willing to do in order to make substantial change in what happens. I think it can be harder for families, for example, with an unsafe sleep death, because they are so raw in terms of the experience that they've had, that I think that it can be possibly easier for them to tell their story to somebody who's not involved in the situation, and then be willing to share the story rather than coming forward and saying something. I had a colleague, and when I worked in a NICU, who fell asleep in a chair with her 6-week-old baby in her arms, and her baby died. And for her, who teaches families about safe sleep, to have had that happen to her was just devastating. And I don't know if she was willing to go out and tell people her story and say, I'm a NICU nurse. It happened to me. It wasn't deliberate. I was exhausted. I'd been up all night with the baby. I sat down in the chair to feed her and I fell asleep. And I think that it's so hard for people to be willing to admit that and to come through that vulnerability and share that kind of story. I think sometimes it might be easier if somebody else tells it with an anonymous perspective.
Thank you, Lisa. And Rachel, thank you for your question. That's such an important add to be considering, child death review teams, as well as FEMA and maternal mortality review teams, capturing the stories of our families. And I think if I understand your question, you were asking about, have there been successful opportunities for families to come forward and tell their stories publicly? And there are many, many examples, excellent examples. Just recently, the state of Indiana actually put out 3 very profoundly impactful videos of mothers who did that very thing. They wanted to step forward, they wanted to tell their stories. One was a sleep-related death in a childcare situation. The other 2 were in their own homes. The Be More for Baltimore project has a wonderful series of videos that do that very same thing. They bring out the stories of families who've been willing to come forward. And families have shared with us that it's not intrusive. It is actually very cathartic to be able to have others hear their stories and benefit from their experiences, so that they could even prevent one tragic loss. They know that it has been worth their effort to come forward with their stories, and told in very respectful and culturally appropriate ways. So Rachel, thank you for your question.
Thank you for that. And thank you, Rosemary, for underscoring the important cultural aspect of this, because I really think when it comes to safe sleep, having stories from different cultures really is important to share the best practice on that. There is a question in the chat, an appreciation of that you mentioned about considering your anchor story and applying that to your work. What other tips or best practices have you discovered for helping other people tell their stories?
I'll take a quick stab at that one. And I know that I mentioned the anchor stories in the introductory part of the presentation. Anchor stories, and that's was very much introduced to us by Dr. Mark Beck. The only way that we can encourage and bring out the stories of the families that we're interacting with, whether it's FEMA or maternal mortality review or child death review, is to understand our own anchor stories. So what drew us to this work? what story anchors us to this work and helping others. And that's what we mean by that anchor story. So throughout the collaborative, we had absolutely moving stories of, so why did you go down this path of maternal child health? Why did you become a doula? Why did you enter into fatality review work? Other tips and best practices that we would discuss in the collaborative, just really going in with an open, listening and caring attitude, so that you don't go into an interview with a family member with any kind of preconceived notions. Many successful interviewers don't even go into the questionnaire. They don't want to be sitting there, with a checklist of questions saying, well, what did you eat while you were pregnant? And, what did you smoke or drink while you were pregnant? They just go in with an open, caring attitude and say, I want to hear the story. I want to hear, if they know the name of the baby, they'll say, tell me about him. What was special about this child? And what do you want other mothers and families to know about your experiences? So I think that would be one of the best tips. Don't go in with preconceived questions or notions, but go in with an open and very caring and listening attitude.
I think too, to build on what Rosemary said, I think one of the important things is that the way that I use my anchor story when I do an interview is I'll usually start out by telling whoever it is that I'm talking to that I'm a nurse with 40 plus experience taking care of moms and babies. And so I'm happy if you have any questions as well about what happened with either the baby or the mom or whatever, I'm happy to answer those. But I always start my interview with, tell me about the baby, tell me about the woman who died, tell me about the pregnancy that you had, tell me about your pregnancy, tell me what you had hoped for this baby. And I try and start there so that we just start by having just a really simple conversation and a sharing. And just, I want them to just tell me their story. And then a lot of times I don't have to use the interview guide at all because they've answered all the questions that I had. It's all there just by having that discussion with them and listening to them and using the open-ended questions. And sometimes I'll say, I do have some questions that I really would like to hear a little bit more about. A lot of that is, do you think that in any way did this person ever, or did you ever feel that you were discriminated against because of your weight, your illness, your race, anything? And I will ask that specifically if it didn't come up. But I will try as much as possible to keep it very open-ended and not in the boxes, but as much as we can, just a conversation.
Thank you, Rosemary and Lisa, for sharing those additional tips. We have such a wonderful group of people here, so I'm hoping we have a few more questions trickling in. We have still 15 more minutes together.
This is Rosemary again. I just want to acknowledge what a wonderful chat Marisol class has said. The information we get from storytelling is priceless, and it's not anything that we can find out through data and methods review. That is so accurate and very important as a takeaway point. So thank you for that.
Absolutely. Thank you for sharing that, Rosemary, and lots of just kudos in the chat and great representation from different states. I'll read out a few comments while I wait for any more questions to trickle in. The power of storytelling is a special public health tool for the lived experience of families. Storytelling and data is the best argument for change. And I think we have comments. I've been thinking about this in the context of COVID-19. Storytelling could be pivotal in our care of pregnant and postpartum folks and their babies. Great, thank you for those comments. Any other questions? Please feel free to unmute yourself or chat it in if that feels more comfortable.
I'll just jump in to comment on Rachel Riley's comment. During COVID, we have found that we've actually increased some of our rates of getting the interviews. You know, it's not always always easy to get an interview with a family member. Pre-COVID, you know, some of our teams would have a 50% rate or sometimes a 70% rate, and that was wonderful. But during COVID, we were starting to see teams who were reaching out and offering virtual opportunities for families. And families were so hungry to connect to someone. No one had let them talk about their loss or about their baby. And sometimes this nurse or the social worker or the person reaching out to get their interview was the only person that had acknowledged and allowed them to talk about the loss. And so again, it was very cathartic for them to be able to share this and to have some support and resources through the interview process. So very important during COVID when we were very isolated and very much struggling to continue with this work in either case review or community action. So thanks for that comment, Rachel.
Can I also jump in and add to what you just shared, Rosemary, because to the point that you were making, Rachel, I mean, our session, of course, was about fatality review, but I believe that storytelling has a lot of impacts, not just to the review process, but can be used in all aspects of our work, especially in advocacy spaces and in uplifting, heightening the visibility of either the initiatives that we're doing or an issue that we see. As I was reading your statement, I was thinking about like, what are the stories that are coming out of the people we serve right now as we are experiencing a formula shortage? Like, what are the stories that families have to share, and how can we use that to elevate and propel to policy, put those stories in front of people who are making decisions in order to continue to move our work forward. And so I just want to continue to add on to your statements, Rosemary and Lisa. I just say, you know, we don't want to be limited, of course, to the fatality review, an incredibly important part of the process. But I think storytelling is a method that has cross applicability to so much of our work, which is important as well.
Thank you, Christina, and for making that connection with the importance and intersection with policy and advocacy. There is a question, is there a guidance tool or script you use for interview strategies?
I'll start off with that one. There definitely is. The National Center for Fatality Review and Prevention has recently put out a guidance document on doing interviews with family members. I'll pop the link to that in the chat for you. There has been, in our regular program manual, a whole chapter devoted to the interview process. So we are very happy to share that resource. I'll pop that in the chat in a second.
AMCHP also has a tool, an interview tool for maternal interview or maternal death interviews for a family member or somebody close to a woman who died during pregnancy or in the year after the end of a pregnancy. And Christine, are you able to find that and pull that up? It's in the review to action guide section there. In the interviews that I've been doing, I started my job about 5 months before COVID hit. So I was able to get one in-person interview done, but all the rest of the interviews that I have done have been over the phone. And I almost wonder if people aren't more comfortable doing it over the phone, where it's a little bit more anonymous, where they don't necessarily have to, you know, you don't have to be in person. You can just kind of get your information out there. Finding people can be challenging. And I will use information that I get from medical records and use the emergency contact person that was identified in a medical record. I'll use social media. I will go on to Facebook and see if the family member that was identified or the person that was identified had a Facebook page, I'll go to GoFundMe and see if this person, if people tried to set up a GoFundMe for this person, and who the contact people, who the person was who set up the GoFundMe. So I'll use lots of different places to try to identify who's a good person to contact. And when I approach them, either by phone or by a Facebook private message, I have a script that I use so that I make sure that I am consistent in the way that I'm requesting the information, and will then try and get an email from them and then email with them to set up a time that works for them to do the interview. It usually takes anywhere from an hour to an hour and a half, depending on how talkative the person is. But if anybody has questions about the approach of doing it, I'm somebody, I kind of equated it to asking when, you'd had to go around with the school when my kids went to school and asking people for money to buy wrapping paper or something like that. I don't want to trivialize it, but I always hated doing that. I always hated having to go out and ask people for money. And the first time I had to do this again, it kind of came back to when I was in research, and I'd have to ask people to participate in a research study. I'd have to ask them if they'd be willing to do it. And it's kind of like cold calling. You take a deep breath and you go in and say, "Hi, my name's Lisa Klein. I work for the state of Delaware, and I'm working with fatality review, either with fetal and infant mortality review or maternal mortality review. We're trying to learn how we can best help families who have experienced a loss." And that's usually how I start out. That's what's in my script and in my text, so that I can try and reach out to people. The first few times it's really tough, but after that, you get pretty comfortable doing it. And you keep thinking about every time you've had an interview, you've learned such rich information that it makes it easier each subsequent time to do it, because you're going to try and get really rich information from people.
Thank you, Lisa, for that response and sharing the approach on how to get started. We do have a question from Lisa Maines. If you want to unmute yourself.
Yeah, hi, thank you. I thought I'd do this one by voice instead of chat. Thanks for those resources on the interviews. I was just wondering if, you ever encountered families that maybe were hesitant because of the interview method, and if you ever offered like an opportunity for them to write their story for you or anything like that.
I have
Great question, Lisa. Oh, go ahead.
no,
Lisa Klein, you
never
can-
had anybody who said, "I do this instead." I have had families who've asked to see the interview guide, who wanted to see the questions that were asked, and I send it to them. I'll email it to them and say, again, this is just a guide. This kind of points me in the direction, but the interview takes on its own direction once you start it. And so if we go off in a direction, I go in that direction. I try not to stay, as I said, I try not to stay in the box. I try and go off in that direction. I would be very willing if somebody would write it out for me and send it to me. That would be great. It would save me a lot of time. But I'm also happy to do it in their space. And that's what this is about. This is their story. And so it has to come in a manner that meets their needs.
Exactly. And Lisa, the only thing I would add to that, in FEMA, we've actually had 3 ways that we get interviews. Clearly, we consider the in-person interview kind of the gold standard, because you have the ability to observe body cues, and they can see your warmth and personal interaction. You can observe the family's environment. Obviously, during COVID, we shifted to either phone or even virtual interviews. And then lastly, many teams have experimented with an online type of system. So sending out a survey that a family could respond to, very confidential. They've used things like Qualtrics or a very secure RedCap database. So posing some questions, giving some prompts, but then just allowing families to tell their stories. And basically, we want to know, what were your encounters like with us, the healthcare services? Were there times when you felt you weren't listened to or marginalized or dismissed? So it's really, the focus is on the systems not on the family of what that mother or that family did or didn't do. It's very much focused on systems issues and what can we, the providers, do better, and what can we change to prevent a loss from happening to another family. So those 3 strategies are used in person, on a phone or virtual, or then the online opportunity to get involved.
Excellent, thank you. We have 4 more minutes, and so that means maybe 1 more question or comment. If anyone wants to type something in the chat or unmute themselves.
This is Trudy Esch from Michigan. I was just going to say that, that storytelling is so powerful when you're trying to do advocacy work or try to understand an infant death or a maternal death. But I think the other thing that's really important to understand is that families who have had a loss, they want to share their story, and they don't want the person that they lost to be forgotten. And so I shared in the chat that I worked with the March of Dimes, and I shared our family story, which was the death of my granddaughter at 10 days old due to prematurity. And to this day, she would be turning 14 this year, and her siblings will, still talk about that they have, a sister in heaven. And it's just that whole piece that you don't want to be forgotten. So here, this is even 14 years later, we don't want to forget. And that's the difficult thing of an infant loss, is the loss of all the opportunity and the things that are missed. And so I think that the context of what we're talking about, family storytelling, is important here, but it's important in a broader way too, that we can participate as community partners to other people that have had loss, because people don't know, should they ask a question? People are awkward. They don't know what to do with talking about somebody who passed. And people just don't want that person to be forgotten. So I think all of us can kind of remember that we can help families that have lost and talk about that person and not shoo that under the rug. And that's really powerful also.
Thank you, Trudy, for sharing that, and very, very truly, yeah, it just how to remember for yeah, it's a lifelong memory, right? Great. All right, so it looks like we don't have any more questions or comments. I want to thank our presenters, Lisa, Rosemary, and Christina. Thank you so much for the broadcast presentation. Thank you so much for joining us in this live Q&A, for sharing those resources, for sharing all these tips. This has been a really rich discussion. Thank you to our participants for joining us. And we can wrap up from there. For those who are participating, please grab the helpful links that Rosemary and Lisa have shared from the chat. And I thank you all, and have a good evening or afternoon.
Thank you.
Sure.